Okay. Well, Terry and I have just been communicating through Facebook about starting school. And I, as well, I'm a former teacher, but I have two kids in school and I work in schools. And I just feel that without this virus being under control, there's absolutely no way to successfully start school and not spread this virus even more rampantly throughout the country. I mean, there's no way to control kids. I think most kids would be compliant with wearing masks and they can do all they can with social distancing, but most districts are having a hard time with substitute teaching. And so once a teacher gets sick, then what are we going to do? Once children get sick, do we then quarantine their whole class? And then do we quarantine all of their siblings? And then, it's just once you've been exposed to it, there's no logical, reasonable way to control it within a school environment. That's my opinion.
I have to agree with your opinion from a biomedical perspective, the medical being the there are too many unknowns when it comes to children and the transmissibility, and the biological part of it is that um, COVID is weird in that and very unlike flu in that not everyone who has it and will test positive, 4 days after contracting it, will move all the way through the entire course of disease and feel, very severe flu-like symptoms and illness.
Mm-hmm.
We believe, and we don't have evidence yet for the hypothesis, but in general, the scientific community, the healthcare community believes that children are just as susceptible to getting the virus. They just don't go through the entire symptomatology like adults do.
Right.
So what does that mean? That means that we're going to put them in an environment where they can spread it to each other. That spread is going to be 1/3 less detectable than it is in adults, according to the research that we do have. And then they go home, and then they are in touch with adults, and those adults have to go to work. And then those adults are in touch with other adults, and then those adults are in touch with other elderly adults. So we could be creating nidus of infection in schools. And what I mean by nidus is we talked about this, and we had a diagram made for us by a friend of our efforts here. And I'll talk about her in a minute. But the diagram is about the ring of transmission, and there are different break points in that ring of transmission that schools need to be aware of, like how does it get from person to person? If it's not in a person, where can it be? And then if it is in more than one person, it's called a nidus, right? In epidemiological terms. So probably, and we'll probably see research on this in the coming months. Our nursing homes turned into nidus of infection,
Mm-hmm.
and they killed 45,000 elderly people in this country. This is the unreported, unaddressed, um, massive tragedy, travesty in this entire last 5 months. So we've got 135,000 people dead right now as a result of this disease. About 45 to 47,000 of them are the elderly, and they died in long-term care facilities.
Yeah.
So the schools could become not a place of necessarily suffering and death like nursing homes, but definitely they could become a reservoir of infection. Okay, so the risk of them becoming a reservoir of infection is only reduced if the surrounding community has a low risk. And that means if the percentage positivity, the prevalence, the incidence of the surrounding community is low, then the likelihood of the nidus being formed in the school is low. Um, but then I have questions about whether I'm surprised to hear you say that you think kids will be compliant with masks, because I don't think they will be. I think they will be when they're in front of adults, but I don't think that kids are in front of adults all day.
Right. Absolutely. Absolutely. I think, somebody was asking me if a second grader would keep a mask on all day, and I said no, but maybe like fifth grade and up, they would. But
And I think this is probably going to be, I'm probably going to develop controversy from saying this, but I have to say it. It is not healthy for a child to wear a mask all day.
no.
Okay.
No.
Because the mask itself can become contaminated.
Right.
You can't, they
And they're going to always be fooling with it and touching it, and then, their hands are going to be.
Kids are filthy creatures. I have.
Oh my God. Yeah.
Okay.
Yeah.
I have 3. I know this firsthand knowledge. So they're filthy, boys especially.
Yes.
And
Thanks.
Sorry.
Sorry.
I kind of laughed when you told your story about going to India and eating the food. That's exactly what happened to me when I first started teaching. First year I taught, I caught everything.
Yep.
Everything. And then really haven't been sick since.
Yeah, exactly. Because they introduced everything to your immune system, and they
Hey, Sanjay?
Yeah.
So there's no data at all for morbidity in children, right?
Correct.
Okay, so the long-term damage done by this virus for the children who get it, and forget about the death count in adults that everyone's so fixated on, that the morbidity, you're going to send these kids back into school and no one knows what that is yet, and it blows my mind.
Correct. Yes. I think the only significant morbidity that we can identify and have a great deal of caution around is the MIS, the multisystemic inflammatory disorder. That we think it's going to be probably less than 2% of children overall, but that's still a huge number of children that could potentially come down with some variant. And again, there's going to be a spectrum of variant when it comes to MIS-C, which is some kids could just develop a flushing and a rash for a few days and get extreme urticaria and flushing and stuff like that. And some kids can come down with a complete anaphylaxis and kidney injury and, imagine just having your immune system turn on all of the spigots, and then the kid just goes into, and it's not caused by the virus. The virus is long gone, right? So we know of this, Kawasaki's. We know that even Guillain-Barré syndrome is a possibility, where there's a ascending myelitis, neuroinflammatory disorders in kids as an immune response to viral infection. So that's down the road, right? that's after they've been hospitalized. That's not even what we're talking about, even though Terry brings up a very valid point, which is not knowing what this could end up causing them. How could we possibly ethically send them back into an environment in which they are at risk for developing that? We don't know, and maybe we do need to do this a couple of weeks, or a little bit of each town hall has to be dedicated to kids and school, because right now, and this was us in the 3rd or 4th week of doing these town halls with COVID in adults. We're now in the very early stages of knowing anything about what it does to kids and what it will do in a school environment. Okay. We now have anecdotal reports of a Christian camp in Missouri where 82 kids and their, what do you call them? Their camp assistants or whatever came down.
Counselors.
Camp counselors have come down with it. Now, if I was running the CDC, I would have a team out there doing case histories on every single kid, right? Every single camp counselor. And I'd be monitoring them on a day-to-day basis. And that would tell us a lot. That would tell us a huge amount just from that one cohort, right? But I don't know if that's happening.
They're making tacos.
Exactly.
They're making tacos.
So
I did see I did see a teacher say that, so she has some kids in a classroom right now. I'm not sure. It must be a summer school situation and it must be a small amount of children. But she did say that the kids are wearing masks and then they're also wearing a shield.
Yeah.
And the shield has cut down on them fiddling with the masks
Yeah.
to a really large extent. So, I
Sure.
mean, that's just, you would think that you would hear some advice from the government about things like that, but we're all learning from each other, aren't we?
Yeah,
We're
we are.
we're our own CDC right now,
Yeah.
everyone. We have to look out for each other. So I did see that.
Yeah.
Well,
Look.
my children attend a small Catholic school in our community, and we just got the letter from administration talking about how, if we in fact go back to school, how that would happen and the things that they will have in place. You know, and it's basically kids are going to wear masks. They're going to social distance in the classroom, which in my kids' school they probably could, but in other schools you can't social distance with 35 kids in a class.
I don't know how you can teach with 35 kids in a class, but go ahead.
Well, that they should. That's another thing that the government has done to us. But I also think, like in their school, they're going to have, you know, plastic or plexiglass dividers on desks, and you know, all the desks will face the same way, and you know, so they're thinking about everything, and they're talking about how throughout the day the kids will clean their desks and all this, but there's just no possible way to do all of that and then teach and have kids learn. Like that's just not going to happen. It's going to be spending your day managing um, kids from infecting each other, and there's not going to be any teaching going on because you're going to spend all your time taking care of.
Yeah, yeah. So, you know, my classmate and friend who's a teacher and teaches 8th grade in North Carolina was also told that teachers are going to have to take shifts in the morning and in the afternoon riding the bus to ensure or to enforce mask and distancing. So what is it that they're not asking the teachers to do? Clean toilets?
Well, that's been a long time. I mean, come on. And there's only so much teachers can do before
No, they break. I mean,
yeah.
we see that with nursing right now. Okay, nurses are being exhausted. ICU nurses are being exhausted, and
Right.
they're the Marine Corps of the healthcare world. Okay,
Right.
They're tip of the spear. They're first to the fight. If you start exhausting your critical care nurses and your ER and these nurses are Marines. They come into work with a 40-pound pack chewing on a box of nails. These are the kind of people that become ICU nurses. Okay, and if you're exhausting them, we've got problems. You're going to exhaust your teachers in weeks with these recommendations. In weeks, it's not even going to be October before they're like, this is ridiculous.
The people making the decisions, they don't even ask the teachers. I mean, at one time they were talking about giving all the teachers guns to stop school shooters because I mean, they didn't ask the teachers. They're like, hey, we're gonna give you a 9mm, save some kids' lives. What the heck?
So are we? Our Q&A panel. I just brought it up, and there is a good question that relates to a couple of things we were talking about. It's mutations from last week, and kids, and do younger, healthier cells, could they advance the number of mutations of COVID and create new strains that are more dangerous? I would say no, not necessarily. The interaction of kids and the virus itself will create mutations, but what will happen is what we see happening in the South and West. If you get an explosion, an outbreak as a result of schools reopening, it isn't just one school outside of Atlanta that will get affected. It's going to be all of Atlanta, okay? And then you've got a massive new outbreak, and that's giving the virus an ample opportunity to further mutate. Any massive rise in the number of cases in a short duration of time gives the opportunity for the virus to mutate. And mutations come from mistakes. So mistakes are, the virus replicates. It's like a copier that gets a piece of paper jammed. Okay, that the piece of paper that jammed that comes out looks like a mistake, but for whatever reason, it's got a bunch of F words written all over it. A mutation is a mistake in replication that ends up being either more virulent and more dangerous, or less virulent and less dangerous. What happened with SARS-1 is it mutated in a way that it ended itself. It came to an evolutionary dead end. Okay, that's also possible too. But we're not going to all sit around with our fingers crossed. This thing has shown itself to be very, very, very transmissible, very hardy, even in hot weather. So it didn't slow down. It didn't stop in the summertime. It has an ability to sit around in people's upper respiratory tract for up to 14 days, allowing for a long duration of asymptomatic spread, which means that in children who are more likely than adults to have asymptomatic course of disease, 3 times more likely, then we're giving the virus an opportunity to take a ride on smaller feet, you know,
Yeah.
and go right into people's homes. So this is the issue. It all kind of ties together, the issues that we've seen around different strains arising, different mutations arising, higher transmissibility, higher case positivity, and not related to higher testing levels. The science is teaching us a lot, and yet we know nothing about what the science has to offer us yet when it comes to COVID in kids. Now, that being said, I want to ask you a few questions as a teacher and a person who lives in and has been around school environments.